Are you studying to take the NCLEX? Well, I've got a practice question for you. So in this question, we're a nurse at an outpatient clinic and we're caring for a client who's experiencing a panic attack. And we're being asked which of the following actions should the nurse take? So before we take a look at our answer options, I like to think about what do I already know about panic attacks? Well, I know that panic attacks mean that this client is experiencing really high anxiety. And that high anxiety can cause them to behave in impulsive and potentially dangerous ways. So I know that my two biggest goals for caring for this client are going to be to ensure that client's safety and to reduce those symptoms of panic. So I'm going to be looking for answer options that I know help me meet these two goals. So let's take a look at what I have. So our first option is to encourage the client to remain seated. Well, that's not necessary for a client who's experiencing a panic attack. And if we think about it, clients who are experiencing panic attacks have a lot of restless energy. So trying to make them sit still is probably going to be a little bit difficult. And it might even be helpful to pace with that client to expend some of that restless energy if we're in a safe space. So I'm going to say no, this probably is not our best answer. Our second option is to dim the lights and turn off the television. So let's think about that. What does that help us do? By dimming the lights and turning off the television, we're going to be reducing environmental stimuli. And that's going to be really helpful for reducing symptoms of panic. Because if we think about it, if a client is panicking and we have a lot of external stimuli going on, a lot of noises, a lot of sounds, a lot of lights, it's just going to increase that panic further. So by dimming the lights and turning down the TV, we're going to create a more calm environment, which is going to help alleviate those symptoms of panic. So I'm liking number 2 as our correct option, but just to make sure we haven't missed anything, we want to read all of our options. So let's take a look at 3 and 4. So our third option is to give the client privacy by remaining outside the room. Well, remember, we said that our biggest goal is to ensure safety. So we don't want to leave that client alone, right? We want to stay with them to make sure that they're staying safe. So I'm going to say no, that's probably not our best option either. And then our last option is to instruct the client to breathe in and out in quick, shallow breaths. Well, let's think about this one. Clients who are experiencing panic often feel like they can't breathe, right? So do we want them to be breathing out in and out really quickly? Probably not. That's not going to make them feel any better. We do want to coach them to breathe, but we want to coach them to take slow, deep breaths to help reduce those symptoms of panic. So I'm going to say number 4 is probably not our best option either. So I'm still liking number 2 as our correct answer option. So let's go ahead and check that answer. And yes, we are correct. Great job. If you found this question walkthrough helpful, I'd like to invite you to come and study with me at our next Facebook webinar. You can find the information below. We're going to go through a bunch of standalone questions to help you feel confident in tackling this item type on the NCLEX. We're going to cover a wide range of topics to get you feeling comfortable. So check out the link below to get more information on when that's going to be, and I can't wait to see you there.